Hey, this is Mason Haley with Wahpeton Family Dentistry. Our goal is to take the fear out of dentistry and help patients make informed decisions about their oral health. Today, we're talking about a question I hear all the time. This is an electric toothbrush versus a manual toothbrush. Which one is actually better? This is one of those dental questions that sounds simple, but it can turn into a full family debate on the toothbrush side. One person says, my regular toothbrush works fine. Another person says, my electric toothbrush has Bluetooth, a timer, a pressure sensor, and probably knows my social security number. Meanwhile, somebody else just wants to know which one will keep them out of the dental chair longer. So let's make it simple. Both electric and manual toothbrushes can work. The best toothbrush is the one that you use correctly, gently, and consistently. But electric toothbrushes can make good brushing easier for many people. That is the main difference. Think of it like this. You can absolutely shovel your driveway by hand. A snowblower is not required. But if the snowblower helps you do a better job faster with less effort, you might use it more often and do more complete job. In North Dakota, this comparison may hit close to home. Brushing is about removing plaque. Plaque is soft, sticky film that builds up on the teeth every day. It contains bacteria. Those bacteria eat sugars and carbs and produce acid. That acid can weaken enamel and lead to cavities. Plaque along the gum line can also irritate the gums and lead to bleeding, swelling, and gum disease. The toothbrush is not magic, it's a plaque remover. Manual or electric, the goal is the same. Clean the gum line, clean every surface, and do it for 2 full minutes, twice a day with fluoride toothpaste. Let's start with the manual toothbrush. A manual toothbrush is simple, affordable, easy to travel with, and it does not need to charge. It will never beep at you. It will never flash a red light and judge your life choices. And when you use it well, it can do a very good job. For a manual toothbrush, technique matters a lot. You want soft bristles. You want a brush head that fits your mouth. You want to angle the toothbrush toward the gum line around 45 degrees and use small, gentle strokes, not big scrubbing. Not swerving back and forth like you're trying to start a campfire. Gentle, short strokes. Manual brushing works best when the person has good technique and takes enough time. The problem is that many people do not brush as long as they think they do. A lot of people think they brush for 2 minutes, but if we put a stopwatch on it, it's likely closer to 35 seconds. 35 seconds is enough time to make your mouth minty. It is not enough time to clean your teeth well. Manual toothbrushes also do not come with a built-in coach. They do not tell you if you're brushing too hard. They do not buzz every 30 seconds to remind you you need to move to a different part of your mouth. They do not keep going when your hand gets lazy. A manual toothbrush is a good tool, but you are the motor and the timer. Now let's talk about electric toothbrushes. An electric toothbrush can help because the brush head moves for you. Some vibrate, some rotate, some oscillate back and forth. Many have timers, some have pressure sensors. Some pause or buzz every 30 seconds, so you spend time in each part of your mouth. For many patients, those features help them brush longer and brush more evenly. Research has shown that powered toothbrushes, especially oscillating, rotating brushes, can remove more plaque and reduce gum inflammation than manual toothbrushes in many studies. But here's the important part. An electric toothbrush is not a free pass. If you use it poorly, if you blast across your teeth in 20 seconds and call it good, the toothbrush is not going to send a tiny dental hygienist out of the handle to finish the job. With an electric toothbrush, the technique is different. You do not need to scrub. You guide the brush slowly from tooth to tooth. Let the brush do the work. Place it at the gum line. Pause for a moment on each tooth. Move along the outside, the inside, and the chewing surfaces. If you scrub hard with electric toothbrushes, you may irritate the gums. It is more like guiding a car through a car wash than hand siding a deck. So which one would you choose? If you're a great brusher with a manual toothbrush, you keep your gums healthy, your cleanings look good, and you're cavity free, you may not need to change. A manual toothbrush could be enough. But if you tend to brush too fast, too hard, miss the gum line, build up sticky plaque, have gum bleeding, have braces, have dexterity issues, or just want help staying on track, an electric toothbrush may be worth it. Electric brushes can be helpful for kids who tend to rush. I say this with love. Some kids brush like they're trying to win a race against the sink. An electric toothbrush with a timer can help slow things down. It can make brushing feel more like a game and less like a lecture from mom and dad. They can also be helpful for adults who have arthritis or limited hand movement or trouble reaching the back of the teeth. The hand does not move easily. The brush movement can help make up for that. The goal is not fancy, the goal is clean. Now let's compare pros and cons. Manual toothbrush pros. It's cheap, simple, easy to replace, easy to pack, and works well when used correctly. You can keep it in one travel bag, gym bag, or desk drawer. If you drop it, you're not sad for 3 days because of how much it costs as a small appliance. Manual toothbrush cons. It depends heavily on your technique. It has no built-in timer. It does not warn you if you brush too hard. It is easier to rush. And if you use too much force, you can still irritate the gums. Electric toothbrush pros. It helps with irritation. It helps with constant motion. Often it has a timer and maybe a pressure sensor. It can help people brush longer, and it may remove more plaque for more patients. It can make a good routine easier to follow. Electric toothbrush cons. It costs more. Needs charging of batteries. Replacement heads cost more. And it can be a little more bulky for travel. Also, some people do not like the vibration. If it feels like a tiny lawnmower in your mouth, you may not use it. And a tool you hate is not a tool that helps. Here's my practical answer as a dentist. I like electric toothbrushes for many patients because they reduce the amount of technique required. They make the habit a little easier. But I do not want anyone to feel like manual toothbrush is useless. It is not. A manual toothbrush used well is better than an electric toothbrush used poorly. Let me say that again, because it matters. A good brusher with a manual toothbrush can beat a bad brusher with an electric toothbrush. If you choose a manual toothbrush, pick one with soft bristles. Replace it every 3 to 4 months, or sooner if the bristles become frayed. If the bristles are splayed out like a bad hair day, the brush is done. Retire it with dignity. If your electric toothbrush has helpful features, a 2-minute timer is big. A pressure sensor is also helpful, especially if you tend to press too hard. A smaller brush can help reach the back. You do not need the most expensive model on the shelf. You do not need one that connects to an app, tracks your horoscope, and sends you performance reports to your email. Simple can be great. The best electric toothbrush is the one you'll actually use twice a day. For some people, a basic model with a timer is plenty. For others, a pressure sensor is worth the extra cost to them. If you have braces, implants, gum recession, or a history of disease, ask your dental team what brush may be best for you. Now let's talk about pressure, because this is one of the biggest issues with both types. More pressure does not mean cleaner teeth. Plaque is soft. You're not trying to remove barnacles from a ship. You're trying to remove a sticky film. Too much pressure can irritate the gums and may contribute to sensitivity. If you use a manual brush, try holding it with your fingertips instead of your whole fist. If you use an electric brush, listen to the pressure sensor if it has one. If it lights up, it is not cheering, it is telling you to calm down. What about kids? For children, either brush can work. An electric toothbrush can be helpful if it gets the child more excited and helps them brush longer. But parents still need to help. Young kids do not have the hand-eye skills to clean perfectly on their own. A good rule for this, if they cannot tie their shoes well, they probably still need help brushing. Let them practice, then have an adult finish your check. For children under 3, use a tiny smear of fluoride toothpaste, about the size of a grain of rice. For children 3 and older, a pea-sized amount is usually good enough. Have them spit out the extra toothpaste. And remember, the brush does not replace parent help. Now, what about people with braces? Electric toothbrushes can be very helpful here. Braces and wires create extra hiding spots for plaque. Food can get stuck around the braces. The gum line can get missed. An electric toothbrush can help, but it still needs to be aimed correctly. Brush above the brackets, below the brackets, along the gum line, and around every tooth. A water flosser or small interdental brushes may also help, but those are in addition to brushing, not instead of brushing. What about people with implants, crowns, bridges, or dentures? The answer is keep cleaning. Dental work still needs care. Crowns and bridges have edges where plaque can collect. Implants still need healthy gums around them. A powered brush may help some clean more thoroughly, but technique still matters. If you have dental work, we can show you the areas to focus on. Let's answer a common question. Do electric toothbrushes damage the teeth or gums? Used correctly, no. Electric toothbrushes are generally safe. The problem is not the electricity. The problem is too much pressure, too much scrubbing, or worn out brush head. Use gentle pressure, a soft brush head, and let the brush do the work. Another question, is a cheap electric toothbrush okay? Sometimes yes. You do not always need the top of the line version. The most important features are a brush head that fits, soft bristles, and ideally a timer. If it has a pressure sensor, even better. The $250 brush is not automatically 5 times better than the $50 brush. This is dentistry, not a luxury car dealership. Another question, do I still need to floss when I use an electric toothbrush? Yes, I know. I wish I could give you a different answer, but I can't. A toothbrush cleans the tops, fronts, backs, and gum line areas. It does not fully clean where the teeth are touching each other. That space still needs floss picks, interdental brushes, or water picks. An electric toothbrush does not magically clean between the teeth. If it did, I would buy one for everyone and retire early. So here is a simple decision guide. Choose a manual toothbrush if you're consistent, gentle, have good technique, and want something simple and affordable. Choose an electric toothbrush if you want help with timing, pressure, consistency, or reaching difficult areas. Also, consider if your dental team keeps finding plaque buildup in the same spots, if your gums bleed, if it feels like brushing is hard to do well. But no matter what you choose, the basics stay the same. Brush twice, 2 minutes a day, use fluoride toothpaste, use soft bristles, clean the gum line, clean every tooth surface, replace the brush or brush head when worn, and clean between the teeth once a day. My favorite toothbrush is not a brand. It is one that helps you be consistent. At Wahpeton Family Dentistry, we are not here to shame anyone about their toothbrush. We are here to help you find what works. If your manual toothbrush is working, great, fantastic. If an electric toothbrush helps you brush better, also fantastic. Dentistry does not need to be complicated. Sometimes the best answer is the one you'll do every day. So the final verdict, electric toothbrushes often make brushing easier and may remove more plaque for many people. Manual toothbrushes can still work very well with good technique. The winner is not electric or manual. The winner is the brush that gets used correctly for 2 minutes twice a day. This is Mason Haley with Wahpeton Family Dentistry. Thanks for listening, and remember, we're here to take the fear out of dentistry and help you make informed decisions about your oral health.